Kia ora koutou and welcome. I'm Peter Bale. I'm normally a journalist, but today I'm the moderator of a panel for the Helen Clark Foundation, which I've done a couple of times before. So welcome to you all, and to those of us who watch this on delay. Um, we're having a webinar today on health, education, and Pacific futures. I've got a little bit of housekeeping to talk about, and to get you to register if you can for the release of this book, led by Peter Davis, the of the Helen Clark Foundation, which is really going to deal with these issues of facing up to our future, and in this case, as I say, health, education, and Pacific futures. I want to emphasize that we will use, if you can, possibly the Q&A section on your Zoom call to submit questions for the audience, and I do have some questions for the expert panel, but I'd like to prioritize your questions. So, as I say, this is the latest in a series of Facing Up to the Future webinars, and it's really conjoined with the launch of the book of the same name, edited by Peter Davis. It's coming out shortly, and there's going to be a link in the chat if you wish to subscribe to it. There's also a fourth section in the Facing Up to Our Futures webinar coming up on trust, taxes, and the treaty. It's something I might just come and look at. I don't think they've asked me to moderate it, but it's got the Honourable Christopher Finlayson, Peter Davis, Philippa Yazbek, and Lucy Castles. And it's next Thursday, a week from today, on the 30th at the same time, noon. And we'll put a link again in the chat for that. As you know, if you're not already a member, the Helen Clark Foundation would be grateful for your support. It's an independent, non-partisan and evidence-based think tank. And if you look on the site and see the publications over the past 2 years or so, it's really at the leading edge of some very important questions facing the country. And of course, it's non-partisan, looking at policy rather than politics as such. I've been asked to make sure also from a housekeeping point of view that you disable your cameras and microphones just in case. We'll be seeing you all at the end of this. And again, please use the Q&A, which is behind the three dots on the right-hand side of your Zoom menu in order to submit questions. It makes it much easier for us to check it out. We'll probably be putting audience questions around 12:40, 12:45. So there's a background to this, which is that many of our most serious social problems in New Zealand, or challenges, have a frustrating quality, which this is what the foundation has said, but it's also true, which is around health, education, and the well-being of Pacific communities. We know what works, but we often struggle to stick with it, particularly through the political cycle. We have a tendency for reforms to be introduced by one government and unwound by the next. And the long-term problems stay there, sitting behind all of those big issues. And we'll be exploring a little bit of that and some of that political circle, in a sense, with these terrific guests. So joining me today are three of the contributors to the Facing Up to Our Future book. Professor Robin Gauld, Executive Dean of Bond Business School in Australia, and one of New Zealand's foremost analysts of the health system, of the New Zealand health system. And he has a piece which I've put into the chat from a recent interview with RNZ on the same topic, but his contribution to the book is with Peter and Dylan Mordaunt on stabilising a healthcare system weakened by underinvestment. I think he has some very interesting things to say that you'll find from in a sense, a political point of view of the health of our health system. Next, we've got Professor Stuart McNaughton ONZM, the Ministry of Education's former Chief Education and Scientific Advisor and Professor of Education at the University of Auckland. And he's authored the chapter on education, performance, and equity. Secondly, we have actually three professors today, of course. Whanau Professor Jemaima Tiatia-Siau, who's Pro-Vice Chancellor Pacific and Professor of Pacific Studies at the University of Auckland, and who co-authors in this book with Sayuli Angel Tamali Tiatia-Siau, a chapter on Pacific futures equity and belonging. Pacific Health and studies in mental health are really her specialty. So we'll be going into that in some depth. I'm going to ask a question each of the panel in sequence to start off, which will make it easier for you guys, for the audience to track this. And Robin is first up, and we're looking at the diagnosis before we get to the solution of the problem, I suppose. Robin, your chapter makes quite a striking argument that the fundamentals of the health system in New Zealand are actually quite sound, which I know will come as a surprise to many people that you may think that. So, I would love you to expand on that. But that it's also been subject to underinvestment, and that changes to the centralisation have weakened delivery. I guess it would be an emergency waits, cancer treatment, and elective surgery. Can you give us your current diagnosis of the New Zealand health system, please?
Kia ora, and greetings, everybody, and thank you for the question, Peter. It's a delight to be here today and to contribute to this discussion. So, look, when we come to the health system and the fundamentals, I mean, we can trust the doctors, we can trust the nurses, we can trust the pharmacists. This is a first world country that has a backbone which is fundamentally sound. We can probably be critical around some of the elements of the health system. We do need a lot more investment into areas such as primary care, but we've always had strong family medicine and strong GP gatekeeping, meaning you must go into the primary care sector before you go anywhere else in the health system.
Mm-hmm.
Some parts of the world, you can refer yourself to a heart surgeon, which is completely inappropriate without some prior work having been done. So we have strong primary care. We've got a public hospital system, which governments have been committed to over the years. It's free of charge to go to a public hospital. This is a good thing. Ideally, we would deal with the fees in primary care to make primary care free of charge as well, and really focus our efforts on that area. We have access to a reasonable range of drugs, which for most people, most of the time, are going to serve their purposes, and prescription charges are reasonably affordable. So, there are some good foundations there. And again, we could probably spend an hour talking about what needs to change in terms of those basic foundational arrangements. I think over recent years, coming back to your second question around the underinvestment over the years, I mean, this is deeply serious as a problem. And if you look at it globally, New Zealand has been going in the wrong direction when it comes to healthcare. So our governments will claim that they've been investing in health over the years, but since about 2008, 2009, the level of investment in healthcare has actually been going backwards. It's barely been meeting inflation rate. The government has been guilty of incorrectly reporting to the OECD the level of investment going into healthcare. And what we're seeing across the health system is the consequences of that. I think, prior to that period, governments also were guilty of not really investing enough. And if you talk to anyone who's been in the health system for a length of time, they'll always talk about this sort of cutback mentality. So every year you're looking at saving, every year you're looking at more efficiency. There's not an investment mentality. There's not sort of a positive culture across the system of, how can we continue to develop a health system and focus on public health, which really is going to be beneficial to the population. This is actually very important because a healthy population is a healthy economy. There's a strong link between these two. Governments, I don't think, really get it in New Zealand. They just don't get that you need to invest in the health of the population, and that means the health system as well, in order to build a healthy and robust economy. So we've been going backwards. We haven't been honest about the level of spending. The current government has claimed that it has put a significant new investment in the current budget, but that's over a period of time, and it's really only going to meet inflation of that. It's impacting waiting times. It's impacting access to cancer services. It's impacting access to drugs. It's impacting IT systems. Again, just in the last 24 hours, that's come up once again. It's impacting workforce stability. So it's right across the spectrum.
So, Robin, I think you're suggesting a commitment to 10% of GDP, which would bring us in line with OECD people we consider comparators. Is that right?
Yeah, that's right. I mean, the countries that are spending more are obviously doing better, and we need to try and, in our argument in the book, get up to 10% of GDP.
Yeah, and before I ask Stuart a question on the same, I am going to drop another one into you, which is you talked about success of governments having different approaches to this and not I think you said that governments are not recognizing fully the impact of health on every other sector and on society. Is that an ideological thing, or are they just not learning the lessons?
Yeah, I think they're so locked up in the mentality of politics in the country and the adversarial nature of the political system that they just can't see the way ahead with health. They can't seem to understand that health is different. It's not roads. Um, it's not airports. It's not customs services, things that you can kind of argue a bit about. Health is a fundamental backbone of a good society and a good economy, and we really need a cross-party consensus on this.
Yeah.
It's increasingly evident that arguing over it and battling and chopping and changing at elections just is not working.
Yeah. Okay. Well, and we'll come back to that aspect of election periods and how that affects us. Stuart, if you don't forget to mute as you come on, please, to unmute rather as you come on. Um, your chapter is kind of similar in a sense, in one sense, to Robin's on health, yours about education. That New Zealand students do generally well on some measures, problem solving, creative thinking, but you've got high bullying rates, rising youth mental health concerns, and achievement gaps between Pakeha and Maori and Pacifica and other communities. Um, what are we missing in solving those gaps and seeing some of them expand?
Yeah, it's a good question, but let me just first greet everybody. Kia ora koutou, e nui ngā mihi ki koutou. Um, what are we missing? Well, I think it's useful to think of the Ministry of Education's twin foci. There's a focus on excellence and a focus on equity. Now, in
Mm.
fact, equity is part of being excellent, but we are excellent in certain areas, and we should celebrate those. Achievement is going down, has gone down in international terms, and we have these other problems which you just referred to, which are to do with high bullying rate, and I would add cyberbullying. But what I want to say, I think, in terms of the diagnostic question that you're asking me, is what we haven't been good at is taking to scale the things that we know work well. There has been a tendency, as you
Hmm.
so carefully put your finger on, to go to a program, think a program is going to solve things, try to take that to scale, and it doesn't work in the long term or across, at a national systemic level, it doesn't work that well. So we have a problem to do with how to make the things that we know work well for everyone generally, and at a national level. I don't think education faces quite the same issue that Robin raised about investment.
Hmm.
I think numbers of commentators, including the OECD, but Robin, probably I need to analyze, as you have done, the statements about how much we spend and what the investment is in education. But generally speaking, commentators say it's not the investment per se, it's what is being invested in.
Yes.
Um, Case in point, which we may return to after a little while, is investing in teachers. I would agree with Robin. Actually, I strongly admire and respect teachers across the board. This is a tremendous asset, a tremendous capability in our system, but they're under stress and asked to do multiple things many times. The OECD finds that our teachers are among the most stressed in the OECD. So we've got an issue to do with knowing what to do well, but implementing that in scale in a way that doesn't undermine teachers' well-being.
Stuart, you've talked about politicians and again, this is not a partisan question, but oversimplifying gaps in education. And you have a relationship to a program that I don't know about, and I'm going to ask you to explain it as well. But Manaya Kalani,
Mm.
could you explain what that is and how that might help us deal with problems of the scale of our education sector?
Yeah, good question. I use Manaiakalani because I know it very well, and a team that I've been associated with has been researching alongside of the Manaiakalani schools for some years. But I use it to try and better understand this issue to do with how you take to scale something that works well.
Hmm.
And so it started as a group of schools in a low resourced in the sense of monetary and financial resources um, community. So schools in the old parlance, schools that were Decile 1 schools, and
Yep.
they adopted a very innovative digital program, and they tested it. Developed it, figured out how it worked very well. So all the kids, all the children in these schools, primary and secondary, had their own devices. They developed new pedagogy to use
Hmm.
those devices. They had a very strong focus on Māori, given where they were, Māori and Pacifica students. Now, the point about implementation is this: it works well, but rather than just duplicate exactly how that program might work in Tāmaki, in Auckland,
Yep.
in Southland somewhere, or in the north, Taitokerau somewhere, what we figured out was that there were certain principles, if you like, if you were going to implement this at scale, that were non-negotiables. These should be in place, but these could be put in place in a contextually appropriate way with iwi or partners that were with communities, with the schools, which in a way that they could determine that would fit their
So,
local
so it's
context.
quite a, it's so it's empowered in the schools. Is this what you're
Yes, it
saying?
is. Yes, but keeping the evidence, keeping to the evidence about what the fundamental principles are to make this thing work, but not making it a prescription in the sense of a recipe that had to be exactly followed school
Hmm.
after school, cluster after cluster. Um, and that's a new way, in a way of us thinking about the integrity of change and how to implement things at scale.
Thank you. I've put a link to the Manaya Kalani site on the chat, and I'm interested in that. I hadn't heard about it before. I'm sure Jemima rather, our third guest will may touch on it. Jemima, sorry, your expertise covers kind of the waterfront really, because you also get into the. I mean, Robin's talked about health, Stuart's talked about education. You're also extremely strong, I think, historically on the question of housing and the contribution that that makes to societal good, if you like. But it's also interesting to see, and the foundation's keen to draw this out, the way you try or you present the Pacifica population as an $8 billion contributor to GDP and a strong sort of potential strong force in New Zealand society overall, and not a kind of marginal group. Would you like to elaborate on that a little bit? Thank you.
Thank you, Peter. Malo le soifua mau malangi e mama, malo le rei. Thank you for the opportunity to weigh on into this conversation. Housing is not particularly my area of expertise, but I will respond to your question. And I think I do want to preface that and make quite clear that what Seoli, Angel, and I allude to in our chapter is not new, but it's an opportunity. This is a
Yeah.
great opportunity to re-emphasize some of that discourse. Um, we 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 argue in our chapter that Pacific futures are inseparable from the nation's future. That's kind of the crux of it all, and it's not really a question of equity for just one community.
Mm.
It's about the country's long-term social and economic resilience. So Pacific Peoples, as you briefly mentioned, it was reported by the Ministry for Pacific Peoples that, we contribute an estimated 8 billion annually to GDP, and as one of New Zealand's youngest and fastest growing populations. So we'll increasingly shape our workforce, our tax base, innovation and civic leadership. However, the contradiction here is that While Pacific communities are central to New Zealand's future prosperity, we still continue to experience disproportionate inequities, and like you say, in housing, and we've heard it earlier, health, education, and justice. And I did want to emphasize that these aren't Pacific problems. They're actually indicators of where our national systems are really underperforming, in fact.
Yeah.
So,
And failing to, presumably, Jemaima, not to interrupt you, but presumably failing to address the potential, to uplift the potential of the people at every level in that, whether it's, I mean, thinking of education in particular, but also in health and the importance of housing in this, but it's failing to release that Pacifica potential.
100%. And so if policy continues to treat Pacific issues as a niche portfolio, then essentially underinvestment in a massive share of our future population, limited productivity, increasing long-term public expenditure, and just weakening that whole social cohesion. You're right. It puts a lid on that container of potential. And so when Pacific peoples thrive, New Zealand benefits through, a stronger economy, healthier communities, greater innovation, and just more effective public institutions. And so that's why in our chapter we advocate for this bipartisan long-term approach. And I did want to reiterate that it isn't just an idea that's decades away. It's already happening. And so investing in Pacific wellbeing is not preferential treatment. I want to make that quite clear. It's about making evidence-based decisions that strengthen, the future of us all.
Yeah, and we'll look a little bit further at in the questions of race and how that's interpreted through policy. But have you got any top of mind figures or perspectives you could quickly give us to close off this section on what some of the gaps are? Are there any sort of quantified gaps or gaps where you believe the problem is really highlighted, like attainment or whatever? What's top of mind for you when you say that there is this gap in Pacifica achievement in these areas?
Evidence shows globally, like for instance, I'm in higher education, that if a student of any ethnicity, but in particular in the context of what we're talking about, of Māori or say Pacific descent, doesn't feel they belong, then you've lost half the battle. And that is on a downhill road to failure, as you put it. So we're completely missing the mark. And if we get that right, if our young people are able to celebrate their identities, their cultures, be able to speak their languages, everything that makes them who they are, we'll see just amazing success and such positive outcomes in education and health and so forth and so forth. But I'm sure we'll talk more about this.
We will. Thank you so much, Jemaima. I'm just going to go back to the top to Robin Gauld, and may I just also remind you, please put questions in the Q&A, which will make it much easier to track. Thank you, Robin. You're the managerial expert in a sense. You're the expert at looking at the practice of deploying a health system, and you talk about equity of access being one of the most persistent problems. What are the roots of people having difficulty accessing services? I noticed it came up in a story on RNZ today, and the number of people who don't have a GP, for example. If the GP is the gateway, it's no wonder the EDs, the emergency departments and emergency rooms get filled up on with people who should be seeing their GPs. What's the fundamental aspects of that access, please?
Yeah, there's probably a list of about 100 things.
Yes.
So I'll try to pick off some key ones. There are some structural issues within the healthcare system, which I did allude to it at the beginning. What I didn't touch on was the public-private mix as well. This is a serious driver of inequity. So, general practice is private, so they must bill a fee. That's built into the model since the historic compromise made after the Social Security Act was signed in 1938. So there is a serious barrier to seeing a GP, but then there are workforce shortages in general practice, serious workforce shortages, which are getting worse and worse over time because of lack of investment. If you've got money or if you've got private insurance, which is voluntary, of course, you need to be able to pay quite a steep price for private insurance or have it through your employer if you're lucky. then you can access the private sector. Now, again, the historic compromise in the late 1930s permits public hospital specialists who are on a full salary to also have a private practice. That's been growing over recent years. That has been growing. It's been consistently in the sort of 40% range, but I understand it's now getting up towards 50% of public specialists maintain a private practice. Some of them are doing it out of frustration with the public system. They don't like the fact that they have to work privately, but they're frustrated because they can't access the necessary facilities in order to, say, operate on patients. Then you've got cultural barriers as well. But I think it's, the lack of investment in the public system to ensure that it has the capacity to deliver. The poor man in the newspaper today in Southland who's not been able to access necessary cancer surgery because of staff shortages. He has no certainty when he's going to get this life-saving treatment. And this is repeated on a daily basis right around the country. If he had the money, he'd probably go private.
Yep.
So
this is one of the critical questions, and I know it's quite a political one to ask you, but it's, you talked about the settlement that historically has allowed doctors to work, particularly specialists, to work in the public and private sector. Doctors I know in those areas would often say that it's partly because they find the public sector incredibly frustrating to work in. And that they have greater efficiency and productivity often in the private sector, but they also have a deep sense of duty to the public sector that taught them, and in many cases, and if they're younger than me or my age, were taught, by the state. I mean, what is this balance between public and private, or is there an optimal balance for New Zealand between public and private? Because that also goes to the heart of how some governments see it and whether we go to an insurance-based system.
Yeah, that's right. Yeah, I mean, this is a highly complex area and very grey area in New Zealand. In some countries, there is a lot more transparency around how all of this works. What you can't really do is sort of point the blame at the doctors. I mean, they're working within a system, and as I said before, many of them are not entirely happy about the fact that they need to work private, but they're so frustrated at what's been going on in the public system, and it's the underinvestment, really. There's no evidence that private's any more efficient. We've done studies on this in the past. There's no evidence that it's more efficient. So any politician or business person who says, well, we need more private because it's more efficient, they need to look at the evidence. The other aspect about private, of course, is that it wouldn't exist without the backup and support of the public sector. So you don't get to go private without seeing a GP. They get significant support from the government, which brings down the patient charge. The specialists rely on the public sector for their training and upskilling. They've all come through medical school, which is heavily subsidised by government. So some might call it all, a bit of a rort, really. I'm not putting words in people's mouths, but there's a lot going on here that we need to unpick more. And it does affect overall equity of access. It affects equity of outcomes. So, this is, as I said, a very complex area.
And Robin, what's your view of the way the current government has worked to reduce waiting lists by directly moving people into the private sector?
Yes, this has been going on for many years, of course. And the current government, I think, is just being more explicit about it and trying to put in place longer-term arrangements, because historically it's probably been a series of contracts that might be set up over a year or two between a part of the public hospital, a region, and the private provider. Private providers have been expanding their facilities now for several years based on predicted demand coming through contractual arrangements. And now that these contractual arrangements are being expanded into 5 and 10-year contracts, there is even more investment going in the private sector through that. Again, it's complicated, and I think because of the historic institutional underpinnings in the New Zealand health system, it's one of many measures to try and improve access for patients. I think anyone who was paid for by a public hospital to go and receive private treatment would probably be delighted about it, unless they're vehemently opposed to that. And I do know of an individual who said, I'm not going to go to the private sector. I won't do this. And they had to be convinced that it was actually the government supporting them, and the surgeons were being paid by the public hospital, not the private hospital. They were just renting the facility in the private sector. So there's a lot of arrangements that are put in place as well. So I hope that's answering your question.
Yep. No, thank you very much. Stuart, let's move to education because you've been at the sort of pointy end of this inside the ministry and as a long-term advisor. And much of what you talk about is stuff that needs to sit over longer than one parliamentary term. Could you expand on you've talked about postgraduate teacher education, expanding Maori medium schooling. Just maybe explain why you think that works, and expanding the representation of Maori and Pacifica people in teaching. All of this is quite long term.
There's plenty of evidence for those areas that you've just listed, Peter. The postgraduate education. I mean, Finland is a good example of this. Over the years, and we've held Finland up as a great case study. Singapore, something like 30% of the top graduates out of secondary school can get access, identified as important to the workforce, the teaching workforce. So, and I want to return to this when we get towards the end of this discussion, which is the status of teaching and raising the status of teaching. But yeah, I wish I had a simple answer to your question. How do you ensure continuity over successive political cycles? I think there are some levers that we can pull, better than we currently have, which are to do with interagency partnerships. I'm thinking particularly of the LTIB process, the long-term insights briefing processes and such like, to develop a strategic view over numbers of years rather than over a short term. So we do have good examples. We do know what we need to do, I believe, but you're right. An issue is to do with continuity. Last thing, before handing over to Jemaima, I want to just support exactly what she said about identity and culture and language. That is strongly significant in achievement outcomes. You can quantify that, and it's partly the reason why expanding Māori medium schooling and growing Māori and Pacifica teaching workforce is so important. Thanks, Peter.
You too address long-term issues, and as you said in your previous comments, none of this is new, but you've been studying it for a very long time. What do we need to do, and what are the first things that you would wish to do to achieve a more bipartisan long-term approach to the needs that you've so well identified, particularly in the Pacifica area, but also in Maori, among Maori?
Thank you for that. I think I would choose two. One would be to continue sustaining, or in some cases building, that genuine, enduring Māori-Pacific partnership, because our history, values, our futures are distinct, but we're so deeply connected. And we found that when we work together, we strengthen New Zealand's social cohesion. It improves policy design, and it creates, I believe, real solutions and benefit. So, say by 2035, what success would look like in that conversation. I mean, it would be more than just a joint thing between Māori and Pacific. It would mean that Māori and Pacific voices are routinely shaping national discussions, but together, in education, health, economic development, AI, even climate adaptation, and
absolutely
all those constitutional conversations. So it would also mean success would also mean Indigenous knowledge systems are valid alongside Western evidence, and there's so much strength in that, and where co-design approaches become more the norm than the exception. And we've seen it in the chat. We know that there are several community-led initiatives that have already shown the value of Māori and Pacific partnerships to elevating those outcomes. So ultimately, this isn't about creating another partnership. It's just recognizing that our future will be stronger when two of its largest Indigenous and Pacific communities invest in one another's success and strengthening what we already have. And then my second commitment bipartisan commitment would be education, where we know, major political cycles agree that education is a national investment. It's not a political cycle issue. And we believe in our chapter, that education is like a major lever because it shapes almost every other outcome.
Yeah. Yeah.
Be it educational attainment, it improves health literacy, employment, housing security, civic participation, and productivity. So a preventative policy rather than a reactive policy, that's the gist of what I'm trying to say. But what would that commitment mean? That commitment would essentially mean that every kid, regardless of ethnicity or postcode, will have equitable access to high quality education from early childhood, ECE, right through to tertiary education. Māori and Pacific success would be embedded as a measure of national success, not just an add-on or targeted program. As Stuart has so eloquently expressed.
Yeah, there's a lot of commonality in what
there needs to be stable investment in teachers, Indigenous knowledge systems, digital capability, and AI literacy. We need to be fully prepared. And just a couple more points: stronger partnerships between schools, families, iwi, churches, employers, and universities. And as much as governments may come and go, the commitment is to educational. The commitment to educational excellence and equity will not go. So educators in this country have argued this for eons, and that long-term political consensus is critical, I believe, for meaningful educational reform.
And Jemaima, we're also in an environment, particularly in a political environment now at the moment, where at least two of the leading parties, so possibly two in government, talk about there being too many race-based. Usually, they're referring to this in a sense of Maori and the way Te Tiriti is read, but you're pushing against a sort of quite large body of politics which says that race is actually something we should ignore in this, and yet we can't ignore the differences in outcome. How do we manage that political force of not doing things on the basis of race, with also recognizing that the outcomes are very strongly aligned with race?
I'm trying to be very careful here and bipartisan in my views, but you can't ignore the fact that there are different outcomes for different groups. Say, for instance, you can't ignore the fact that ethnicity is not a factor, because some things like structural racism, institutional racism, and biases do have an impact on poorer educational outcomes, negative justice outcomes, negative health outcomes. So you can't put everyone into one box, or at least be open to the diversity. And that's our superpower as a Pacific nation, and our place in the Pacific with an Indigenous population and a constitutional tiriti or waitangi. With that, we need to harness that and position ourselves around that.
Stuart, let me just briefly pick up you on that, because you've identified this as a very large gap, particularly in outcomes, and you have some ideas about how to take the paucity of those outcomes, or the problems with those outcomes, and turn it into positive policy.
Yeah, I think there's a dare I say it, a scientific approach to this as well as an equity or ethical approach to this. I mean, to me, the science is pretty clear. You've got to acknowledge and boost and optimize, as Jemaima said, children's backgrounds, their cultural identity, language, in order to achieve great things. And, for example, reading comprehension, and other aspects of the way children learn at school is very dependent on, as Jemaima said quite a few minutes ago, on their feeling they belong. Yet our students say they don't feel they belong at school a considerable number of children feel that they don't belong at school. So there's a scientific approach to this, but there's also the equity approach, which says that if you want success in a system, you've got to differentiate your provisions, your resources in a way to achieve that success. I mean, a simple way of thinking about this is if you want children to achieve at a similar level on an achievement test, they may need different sorts of resourcing in order to get to that point. And that requires a view of the nature of resourcing for different groups. Now, it's not a racist policy to say, in order for us to support Māori and Pasifika students, we need to acknowledge, as I said, we've said,
Sure.
their language and culture and backgrounds.
Stuart, thank you very much. I'm going to go to audience Q&A. I'm sure, Robin, you would have something to say on that also. Let me also say Robin has to leave probably at five to the hour. So I will give him slight precedence over some of these questions. And also, if I could just remind you that the reason these three experts are here are because they've contributed important sections of this book, not because they're necessarily the spokespeople for everything in a particular sector. They've done the hard yards, as it were, on this book. Robin, let me please go to a question for you from Jamie Hosking in the audience. He's just talking about equity in health, and he asks whether there's a role for the government to pilot fee-free, publicly provided general practice with GPs on public salaries, I guess breaking that historic private-public aspect that they work on, particularly in underserved communities where I guess they might have some sort of bond or requirement to go and work in them. Robin, would you take that one, please?
Yeah, no, sure. Thanks for that question. I mean, there are organisations. They tend to be Māori or Pasifika organisations that function on that model. I think there is always opportunity for putting in place pilots such as this, and I think within the mainstream, in speech marks mainstreams of general practice community, I think there's a increasing will, especially amongst younger doctors going into general practice, to work on a salary and a no fee basis. I don't believe that they are widely interested in going into buying a private practice and charging patients a fee. So I think now more than ever, there's an opportunity for governments to think really ambitiously around how they completely re-gear the way in which primary care is funded, including aiming to take out the fee for service, because this is a serious barrier. Even $5 for many people is too much, and they will avoid seeing the doctor for that fee. So no, good opportunity. It's a very good question, and let's hope that this comes up through the election cycle.
Stuart, let me come to you. It's a general question, and I may go to Jemaima on this one as well. But it's from Joe Moffat, and it's asking a very simple question in a way, but a complex one, which is how we get politicians to listen to evidence, to make evidence-based decisions when looking at policy and law. She says rightly, it doesn't seem like rocket science. But Stuart, you've probably, am I right in thinking you've been at this policy end quite substantially?
Yeah, it's a good question. I'd probably reframe it somewhat, and to say, how do we work with politicians, those of us who are sort of researchers or academics in this partnership, in a way which means that that all the evidence in its difficulty, complex nature is put on the table to enable serious and well understood decisions to be made. That's your reference to what I'd been writing about previously around being too simple about some of the solutions is really apposite here. My experience is that politicians do listen to evidence, but it might be piecemeal and it might be limited and it might only be some evidence. And that bothers me. Some of that is a responsibility of us academics to make sure that we are able to provide the evidence in a way that reflects the complexity and the richness of that evidence, rather than a specific part which potentially is self-serving.
Thank you very much, Jemaima. I'm going to come to you now.
I think a lot of it is outside the individual. And it's not necessarily a finger pointing exercise. I think we have to change narratives, that deficit thinking. There are things out of our control. I think, I had my mind thinking about personal and government responsibilities,
Yes.
and that kind of hones in on that. And so my thinking around that is that, some people may look at that and consider that, well, the fault of, say, the caregiver. But I think it's everyone's responsibility to make healthy choices and pursue education. What I'm trying to say is we can't ask people to overcome barriers that are structural in nature through
Absolutely.
individual effort alone. For instance, if a young person is studying while working, say, 2 jobs to support their family, or families living in overcrowded housing, or can't get access to timely healthcare, those aren't matters of personal choice. They're actually policy
Yeah,
choice.
so there's a fundamental equity aspect there that sits behind it.
Absolutely. And so, I think we create a false narrative when we frame it as a personal responsibility, as has been in that quote, versus, say, a government responsibility. I think you need both. And so, when you have both individual and government responsibilities, it creates a more fair and equitable opportunity for us as New Zealanders to fulfill them.
Thank you.
But I also wanted to emphasize that, for Pacific peoples, it's important that our cultures are more around the emphasis on collective responsibility. And I think as a nation, that's something to harness, and we're often caring for more than ourselves, more than a single unit, and those strengths should be recognised as assets, not mistaken.
No, I think that's thank you. Robin, would you like to address this? I mean, it came up particularly about education, but it also comes up repeatedly in health, this aspect of individual responsibility. And you will hear quite a lot of New Zealand politicians, particularly on the right, raising this question of people's own responsibilities for their own education and health outcomes.
Yeah, look, this is again a highly complicated question, and we have a whole series of historic barriers for why individuals have a challenge accessing healthcare. I mean, there is the financial barrier, which is the obvious one. And there are huge differences between the well-off and the less well-off, and then culturally to Māori, Pacifica, in terms of access. So part of that's kind of funding type questions, but there are also cultural barriers. Sometimes it's other issues to do with remote service and so forth. So there's a whole sort of raft of areas. I always sort of think one of the most important things you can do is think collectively about this. So, how do you make it easy for a whānau, a broader family? How do you make it easy for them to be talking about health, being proactive? How do you reduce all of the other barriers, the financial ones, the geographic barriers? Someone mentioned it costs to get a bus, and then there's the prescription.
Yeah.
So how do you work on all of those? This is very complicated. I do think we need to get a discussion going around a standard funding model so that everyone has the means to pay for healthcare, regardless of whether it's public or private. So it's a complex question, and there's a lot of answers to it.
Yeah. Robert, let me ask you another one, and that's because there's somebody in the question who I interviewed when she was appointed to be head of Te Whatuora, Margie, and she says Ashley Bloomfield has called out the need for longer term planning, 10 years in health. Investment in health needs a long-term commitment. Can you comment on what we can learn from other countries that seem to take a longer term view on their health system?
Yeah, I think the country that does it best that comes to mind is Singapore. Singapore has a 10-year hospital construction plan. They're already starting to plan for hospitals they're building several years from now. And so they're right ahead of the game. Singapore has a strong investment in primary care. It's free to go to what they call a polyclinic, which is a primary care government-run clinic. And I often think, what's different about teachers and police? Why can't we have health professionals also just paid for to provide healthcare? So Singapore has a very long-range view. They have a different political system, of course. They're very strategic. I think we can learn a lot from them. You've got Finland. Finland also is very good at getting hospitals up and built. I'm from Dunedin. I've been to Finland. They built a hospital the size of Dunedin's in 4 years, and they changed their mind after 2 years. They went for a high building rather than a flat building 2 years in, and they still got it done in 4 years. So there are many that we could look to for this.
Yeah, and let me just put when I interviewed Margie Appa, she said something that, or Margie Appa, that she said something that really struck with me, because I asked her this one about personal responsibility, and she said, "Yep, I'll talk about that when my kids don't have to go past so many vape shops and fast food places and liquor stores on the way to school." And I thought that was a really effective way of dealing with some of the issues that that these kind of questions bring up. Jemaima, may I ask you probably the last question from the audience? Which is from Len Cook, and talking about recognizing the needs in these fast-growing and young communities in New Zealand, and reinterpreting that as an investment in them, or an investment in the whole country, as you've described the contribution to GDP. Are there any lessons from what's already been achieved? I mean, Stuart mentioned that the particular education system. I'm thinking about Kohanga Reo, which is very old, of course, now. But what are some lessons that you would wish were applied to taking full advantage of these young and fast-growing communities?
Just very, very quickly, I think investments in education, immunization, public health, and early intervention. These are consistently delivered long-term social economic returns, and internationally, the OECD has repeatedly shown that investing in our young people strengthens workforce participation and all. We don't see the value and the need. We're too busy telling them to be resilient when we should stop that narrative, because they're already resilient. So I think focusing on our children and young people, who are the future leaders and future workforce.
And how hopeful are you that politicians will hear you? What can the three of you do to and I'm going to get you to answer for the other two, but what can you do to make sure these are heard? You're doing it, I suppose, by writing this section in the book. What can you do to make the politicians see that?
We have the youth voice at the table.
Yeah, thank you very much. I'm going to close down the audience questions now. Thank you all very much. I've got a final question to each of the three, which again I'm going to ask Robin to do it, because he has to go in just a moment. There's a through line in the book from the Helen Clark Foundation that we need durable cross-party solutions that go beyond any single government. So is there a commitment this year that a government could make in an election year that would be effective in addressing any of these issues? Robin, please.
Yeah, sure. So I think our politicians really need to come together around healthcare. I don't believe that any of them have the capability to do so, which is astonishing. And it's a national scandal. We really need our politicians to say, it's time to work together, because at the end of the day, people are suffering and they're dying, and they're not getting access to what we would consider first world healthcare or public health approaches.
Stuart, would you like to address that as well, please?
Well, I think Robin has hit the nail on the head, that there is a coherence that needs to develop between the various parties, between the various political positions. But it's not my expertise to figure out how to bring them together. But that would be what is needed, and a long-term commitment. You were going to ask a question, I think, when you sent us the material, about what would be a question you would ask political parties. What might a parent, what might whānau members ask a political party? And I thought about that question, and it's very complicated. You could ask so many questions, but one might be, how are you going to raise the status of teaching? Because many things sit under the notion that we should value our teachers. Many things to do with their stress levels, to do with their terms and conditions of employment, to do with their knowledge, to do with the postgraduate education that we referred to earlier. These are all things that would contribute to a healthier education system.
And Jemaima, on this question of what's one thing you'd like to see a party or any of the parties commit to in an election year to achieve this kind of long-termism that you're seeking?
I think investing in a commitment to investing in our Pacific children and young people, and you can only ever do that through education. It's not a Pacific issue, but it's increasing for the New Zealand workforce, as I keep harking on about. And I firmly believe that education is the most powerful form of prevention, and so it improves outcomes. It'll improve health outcomes. It'll improve all the isms and economic mobility through generations. And so I would ask a politician this question if you're out there voting, ready to vote. I would say, what are you going to do to make sure every Pacific kid has the same chance to succeed as every other Kiwi kid? That's probably it.
That's so interesting. Thank you, Jemaima. Having had Robin now leave, but it's very clear that equity sits behind, or access is an issue of equity, and that equity sits behind all of these questions that Peter Davis is calling out in this book. Is that right? It's all about access and who has access and who doesn't. Is that correct?
Part of it.
Thank you. Stuart, would you like to close on that basis? I mean, it kind of brings together. It's interesting the way, and it's been a bit circular, but it comes down to access and who has access and why they don't have access. Is that correct?
I think that's only half the thing, half the solution. The other half is what you do with that access. Somebody in the chat has pointed out the distinction between equal outcomes and equitable outcomes, and you can look at some of the data that from the most recent sort of assessments here, you can raise sort of levels for the different groups, but the gap still remains. Everybody's raised to the same degree, and the gap continues to be the gap. So it's the quality that is provided, the resourcing that's provided through that access that's important as well.
Great, thank you. Any one quick last word, Stuart, before I ask Jemaima for a last word?
Well, I think it's really important we have these conversations. It's very hard, as others have pointed out in the chat, to do justice to these complex matters in a brief answer. But it's really important to have the conversations, and so thank you for the opportunity, Peter, and the Helen
thank you for your expertise and the contribution to the book. Jemaima, any last words for our audience, because many of them have been both moved and supportive of some of the things that you've said.
I think there needs to be a shift in the conversation, like from short-term election promises, and I think we should be focusing on intergenerational responsibility. And my co-author Sayuli, and both of our line of work, Pacific communities and success would mean that no young person has to postpone their education or health challenges just because their family can't afford it, or the cost of living. And we need to come from a strengths-based narrative rather than the traditional deficit conversation we've been having for a very long time. And I firmly believe that this is what should drive the national vision.
Yeah, thank you so much. I think you've tied it together beautifully, the aspect of health that Robin led on, education that Stuart led on, and then you bring it together in this intergenerational aspect, and also with a very deep understanding of where some of the gaps are. Thank you very much, and thank you to our participants and to the audience. The Helen Clark Foundation will be publishing this book shortly. Like I said, go on the site and register for it. And there's another webinar in this series next Thursday. Thank you very much, everybody.